Good afternoon, Canada. Welcome to another True North Report. My name is Andrew Lawton, fellow with True North, here to talk about the last free thought platform in Canada, or so it feels with the shenanigans that have been going on in Parliament the last couple of weeks. But we're not talking about that. We're taking advantage of that and talking about the fight against socialism, which is not an exaggeration now, because an advisory council appointed by the Liberal government is now pushing for a $15 billion a year universal socialized pharmacare plan. So I want to talk about that at a fair bit of length, because there are a number of considerations here, not just the policy considerations and the dollar value, but the timing of it. Because anything that the government does this close to an election, knowing we're this close to an election, is something that you have to look at with a bit of a cynical lens. Not a critical lens, but a cynical lens. Because the government is always trying to rig things in its favor. That's not exclusive to the Liberals, but it's something that incumbent governments tend to do. So I'm going to talk about that here, but I want to just give a bit of a background before we get to this point as to who the main players are of this, because the chair of the Liberal government's Advisory Council on National Pharmacare is the former Health Minister of Ontario, of my province, Eric Hoskins. Now, Eric Hoskins is a doctor, so he knows healthcare, he knows medicine, but he's also a former Liberal cabinet minister. Not just a former Liberal cabinet minister, but a former Ontario Liberal cabinet minister. And the Ontario Liberal government under Kathleen Wynne and the preceding government under Dalton McGuinty, these were very socialist governments. They were very far-left governments, even by Liberal standards. And much as Justin Trudeau is on the left side of the left in his role as leader of the Liberals, Kathleen Wynne and the Ontario cabinet, which included Eric Hoskins, they were all on the left side of the party and of the political scene at the time as well. So Eric Hoskins is an ideologue. Even if he is qualified to weigh in on medicine, he has an agenda, and that agenda is going to be inevitably driving anything he says about this. So when he was appointed as part of the Advisory Council on National Pharmacare, it was a given that it was going to end up at some point with a recommendation for socialized pharmacare. The whole committee, the whole commission, the whole Advisory Council was there to explore national pharmacare. So the government does not spend money. And I don't know what the price tag of the investigation or of the study was, but government doesn't spend money to get a report that at the end of it says everything's fine the way it is. When government does a big giant study like this, and this has been going on for a year and a half almost, when government does that, government has pretty much already decided what it wants to do. They just want to have a big report to justify it so that they can say, well, you know, the experts, they looked into it. We didn't decide, the experts decided this was the best way forward. And I think that's what happened here, because the council released yesterday a 171-page report. And the crux of this report is that a new drug agency would be created. So a new bureaucracy. And this bureaucracy would look at the national list that it would form of prescription drugs that would be covered by the taxpayers. And this would start by 2022. Now, what's relevant about 2022? Well, it would be implemented. It would be in effect before the next election. It would be implemented before the next election, and then they'd put in place a rollout to do the full version, a more comprehensive plan that would have more drugs by 2027. And the price tag by 2019 estimates of what it would cost in 2027. There are a lot of variables there, but the estimates today are that in 2027 it would cost $15 billion a year. And the price is ridiculous, but we know it's going to be even more than that. So I don't even want to focus in on that number, that 15 billion number, because I know that that is basically a lowball. These things always cost more than the governments say they're going to cost. But what this committee is recommending is an 8-year-long rollout to socialized medicine, the last bastion of non-socialized medicine right now is pharmacare. in Canada. And what the government wants to do is move it so that we have in Canada complete socialism when it comes to healthcare. And I use that word socialism. That's a dictionary definition of what this is. You can say that socialism is fine, but you can't say that this isn't socialism. It is a socialist idea. But one big problem that I have a number of problems, but one big one that I have here is that if Canada's healthcare system, the parts of it that are government mandated right now, was working completely fine, and everyone had great healthcare, and we were spending money efficiently, and there were no wait times, and hallway healthcare wasn't a thing. If everything in our healthcare system was working, and this idea of a big government approach to healthcare was working, and the government said, you know, this is working so well, people are healthy, we're keeping the cost down, the system is running smoothly, efficiently, everyone's getting looked after, maybe we should expand it to pharmacare. I would ideologically object to it, but I wouldn't be able to argue with results. If the government was actually doing what it thinks it's doing, I would have to say, all right, well, it's at least a sensible discussion to have, but that isn't the case. And I'm dealing in a hypothetical there because the healthcare system in its current form is not working. It's not working. There's a reason that provinces, in particular Ontario, where Eric Hoskins was health minister for years and did nothing to curb the rise of hallway healthcare, protocols that have to be in place at hospitals to treat patients in hallways because they don't have beds. You've got, in some parts of the provinces, empty surgical suites because hospitals burn through their allotment of surgeries they can perform on hip and knees by September. You've got wait lists for MRIs in some parts of the country that are going for years. You've got a patchwork of systems across the nation and very poor data collection in some places. In Ontario, this is what I know the best, in the Ontario situation, the previous government, the Liberals, actually rigged the numbers so that you couldn't get accurate stats on wait lists because they would only calculate waiting times from when you saw a specialist to when you were treated. They wouldn't count the referral to the specialist. So there are huge problems with the current healthcare system right now. Why is expanding that bureaucracy, why is expanding the scope of what government has to control going to be the best way forward? Now, you've got a number of unintended consequences here as well, and I'm going to get through those in some detail, but I just want to rhyme off a couple of now. For those who are tuning in, Andrew Lawton here with True North. We're talking about the federal government's proposal now that it's received from the Advisory Council to put forward single-payer pharmacare. So basically taking the way that our health insurance works now and expanding that to drug coverage. You've got people that pay significantly into company benefit plans, insurance companies that cover drugs for people without issue. I don't know what happens to those drug companies. I don't know what happens to those insurance companies. I don't know what happens to the money being paid, because what they're arguing here is single payer. It's not a supplement to those who don't have coverage. It is single payer. So this proposal, as it's laid out, would replace any private drug coverage you have, which means even if you're one of these people that has a good job and you have good benefits and you have good drug coverage, that may be replaced by the government, whether you want it to be replaced or not. And you know, this happened in the US when Obama introduced the Affordable Care Act, or Obamacare. The big lie that he told, and I think he may have believed it at the time, is no one's going to lose their insurance. Now, Obamacare was not single payer. Obamacare was forcing people to get health insurance, forcing insurance companies to make it available. But people lost their insurance. People that had it lost it because the insurance companies needed to offset the money they were losing through Obamacare by charging existing customers more. So a lot of people couldn't keep their plans. Whereas right now, let's look at the way it's unfolding. The report says by 2022, so that is 2.5 years from now, they want a list of common and essential drugs. So I don't know how many this would be. Maybe it's 500 drugs, maybe 1,000, but they want a list of just the basics. And then 5 years from that point, implement the comprehensive list. Well, what happens if your company in 2022 that gives you insurance now says, we know the government's putting its plan in here. 90% of the drugs that our insurance plan is paying for are common and essential. So we're now suspending our benefits program. We will no longer offer drug coverage. And let's say that you're one of the people that needs an uncommon drug or a non-essential drug by the government's metrics here. Well, all of a sudden, the government's not covering it. Your employer's not covering it because they think the government is. You're left out of pocket, even though you're already paying the tax money through this. And I realize this sounds circular, but the point here is that behaviors always change when people think someone else is footing the bill. The behaviors always change when people can look to government and say, oh, well, government's dealing with this. Government has it covered. Now, no one is arguing, least of all me, that we shouldn't be covering drugs for those who can't afford it, for those on disability, those who don't have access to benefits, those who need life-saving cancer drugs that aren't covered by health insurance, for example. Yes, I'm all for finding a way to make this work. But to take universality and impose that on people, regardless of whether or not you have coverage, is absolutely wrong. It is government trying to bring everyone down instead of lifting everyone up. Because we have to, and Margaret Thatcher gave this famous speech, and you should watch it on YouTube. I don't have the clip handy, but she gave this famous speech, which was, I believe, her last speech ever in the British House of Commons. And the Liberals were, or the Lib Dems or Labour, I can't remember who it was taking aim at her for being pro-rich and pro-this. And they said, the poor the gap between the rich and the poor has gotten bigger on your watch. What do you have to say for yourself? And Margaret Thatcher, spectacular woman that she was, used her hands in it. And this is why the video is great, because the Hansard wouldn't pick it up. But she said, what's happened is, the poor were here and the rich were here, and she brought everyone up, but the rich got richer. And she was saying that, yes, the gap may have widened, but everyone was better off. And she said, the left would love nothing more than for the poor to be poorer so long as there's less space between them and the rich. And she's right, because the fundamental premise of socialism is that it brings everyone down. It brings everyone down to the same level instead of giving everyone the opportunity to move up a level. So yes, let's focus on people that can access drugs that need to. Let's focus on how pharmacare could ease up. If you had greater access to drugs, that could actually ease up on the burden in hospitals, because people are able to take advantage of something and be more healthy in the interim. And I don't want to get into these conspiratorial debates about big pharma. Yes, I know pharmacological companies have a powerful lobby. I also realize that drugs save lives. So I don't want to debate any big pharma stuff. I haven't had anyone yet, but I just know there's going to be a message about that. So I'm trying to nip that in the bud right now. I want to focus on the economics of it here, because it's the economics that are going to, I hope, get Canadians to look back to the government and say, we don't want this. Because again, if government is not doing socialized healthcare well now, what makes you think they're going to do it better or even as well if you add another layer of bureaucracy, add another program, another agency into the mix? It just is not going to work. And Doctors for Medicare is a Canadian group that's very powerful. They resist any changes to the healthcare system, even if it would be demonstrably better. Demonstrably better. They fundamentally do not like it. And one great example of this is, and I've done a video on this before, paid plasma donations. In Canada, it is very difficult in, I think, pretty much all provinces to get paid to donate plasma. Now, plasma is essential. It's needed. It's used for a number of medications and drug products or blood products. And most people don't want to donate it because it's a big time commitment. So clinics in the US and in, I believe, Saskatchewan, and there's one other place, set up shop, where they'll pay you. They'll pay you, I think, $60 or whatever to donate plasma. And the left has tried to ban that because they don't like the mixture of profit into the healthcare system. But the reality is that we don't have enough plasma. And the shortage of plasma has to be fulfilled by buying it from the US, where donors are paid. So Canadian Doctors for Medicare doesn't like it because there is a dollar value. They do not like money changing hands, so they fight it. So I have no doubt they're going to love this. I have no doubt they're going to absolutely love this, because it means the government will further its stranglehold on healthcare in Canada, irrespective of whether it's doing what it's responsible for doing now, as well as it needs to be proud of this system. And remember, this is not an advocacy for American-style healthcare. I'm saying, as I've said time and time again, that healthcare does not need to be a binary between Canada and US. It doesn't need to be a dichotomy. The best healthcare systems in the world have both private and public components. Switzerland is a great example. Germany is a great example. And even a lot of these Nordic socialist paradises that the left likes to exalt as being the greatest countries in the world, they don't have completely public systems. They all have private options and private alternatives. So it's impossible to talk about national pharmacare or universal pharmacare without looking at the broader issues in healthcare, because government's trying to say that it's doing everything perfectly, so therefore it should be able to do more and charge us more, billions more per year. And the outcome, I've already told you a couple of examples, is that people are going to find themselves unable to have certain coverage because their employers are going to think that the government has, and also that, and this is the big thing, government is not going to do things as adequately as they're supposed to be. So I would tremendously, tremendously like to see a greater discussion in all areas, but healthcare certainly, about where government needs to be and government doesn't need to be. And I'll give you a great example of this. So today, just today, perfect timing, I had to go get an x-ray done. Nothing huge, I'm still alive, I'm still here, I'm fine. But I went to an x-ray. Now I went to a private x-ray clinic that's covered by OHIP. So which is the Ontario Health Insurance Plan. So it's privately run, privately owned, but the government is the payer, if you will. It's single payer. And I had a great experience. I had a great experience. When I drove into the parking lot of the medical building, I had to get a little thing, and it says, you know, your first 15 minutes is free. Everything after that is, I think, $4 an hour or something like that. And wouldn't you know it, from parking to going inside to checking in to getting the x-ray done to getting back to the car, and I had no appointment, I was a walk-in, all of that was less than 15 minutes. So I didn't have to pay for parking because it was that efficiently run. Now there's an example of how, yes, it's government funded, but it's being run with private sector efficiency. I realize it may have been a one-off. You go in some days, you probably don't get that experience. But family medicine clinics are like this. They're privately run, privately owned corporations, but the billing system is through the government. And there's a variance. There's a variance. Some of them are really efficient, others are really inefficient. You go to hospitals, government owned, government funded, everything goes through the government, and people have nightmarish scenarios because hospitals have to pick up the slack of every other area of the healthcare system not being run as effectively or as adequately as it should. So I do believe it is essential for private sector and public sector to work together. I mean, the libertarian in me thinks, okay, maybe there's a way to do it without government, but it's not practical. It's not going to happen in Canada. So the libertarian in me can just kind of take a step back, and I realize that there's going to be an option that will get everyone who is there. So Priscilla writes, a national pharmacare purchasing plan makes sense, but not necessarily single payer. Well, the problem is that I don't think you can have a national purchasing plan without it devolving into single payer. Because once you create a single market, which is a big part of this, once you create a single market, you're not actually giving people access to the market. You're giving people access to the confined market that you've created. And that's a nuanced difference, but it is still a significant difference nonetheless. And not that I'm comparing, you know, aspirin to alcohol, although, I mean, some people might like alcohol more than the drugs, but, you know, you look at the LCBO, the Liquor Control Board of Ontario, the largest purchaser of wine and spirits in the world, but that purchasing power doesn't give consumers cheaper or better access to products because the purchasing power has made it a monopoly. The purchasing power has given it a monopoly. So if government is the single purchaser and in many cases, the single payer. If that happens, government also becomes the gatekeeper to what drugs you can have and what drugs you cannot have. And that's very dangerous because we've heard horror stories, and I don't want to rhyme through them because you can look these up very easily, but we've all heard horror stories where someone wants to get access to some treatment or some drug and they can't in Canada. The government won't cover it, the government won't allow it. Even when people are prepared to pay out of pocket, they're not allowed to. And those problems only get more accentuated. They only get more accentuated, those problems, when you make government the monopolistic source here through which everyone has to go. Now, I want to read what Eric Hoskins said, because this is what the council proposed. They've said that they want a $2 copayment for common drugs, $5 for less common ones. And now, interestingly enough, that I actually like. If you're going to do this, put a copay in. I would love to see a copay on family doctor visits and basic emergency room visits myself, but neither here nor there. But he says that the council studied various pharmacare models, and they talked to 32,000 Canadians and organizations. They had meetings across the country, and now it's time to show courage and boldness. Wait for it. And do some nation building that would benefit Canadians in unimaginable ways. This guy is no longer a politician, allegedly, but he's using political language. His report, which should be a detailed economic analysis, is talking about courage and boldness, nation building, transforming Canada in unimaginable ways. I mean, this guy's a liberal. And look, I don't dispute that a liberal government should appoint liberal people. I mean, that's the prerogative of government. But what he's produced here is a political document, not an economic one. Now, I'm working my way through it. I haven't read the whole 171 pages, but I've read the conclusions. And, the one thing that people should find very dangerous here is that once you give government control of the healthcare industry, which it already has for the most part in Canada, once you give government control of the healthcare industry, you give government license to control everything else. And just look at the stories we've covered that I've covered here with True North in the last year. Things like government weighing a sugar tax, or warning labels on things, or an extra tax on alcohol or whatever. And the excuse that's always given whenever these nanny state proposals come up is, oh, but if people use this, if people drink a lot of sugar, smoke cigarettes, do this, then it causes there to be a burden in the healthcare system, and then everyone has to pay for it. So government's control of the healthcare system is an excuse for government to control every part of your life. And if you give government control of pharmacare in this way, and by the way, it's not about regulation. Pharmacare is already regulated in Canada significantly. Drugs are regulated. It's about regulating the transactions of them. You are, again, letting government control every step of your life, because they're going to say, well, we have a vested interest in your health and your well-being, which means we get to control all of these other things that you do. And what Eric Hoskins said about this is that this is our generation's national project. So when he says that he wants to do some nation building, he's being very honest. This is just a chilling line. He says, quote, "Let's complete the unfinished business of universal health care. That can be our promise and our legacy to each other and to all future generations." Unfinished business of universal health care. Now, I would say that universal health care itself right now is unfinished business, because it's not performing as effectively as it needs to be, as healthcare needs to be. And I think we've learned that universality does not mean single payer. You can have universal coverage without government needing to be the single payer behind it all. Universality does not mean choice has to be thrown out the window. But when he says the unfinished business, again, he's saying that we want to make sure that we railroad through every single possibility we can of government control of healthcare. And the one thing that the government's bragging about here is that the amount spent on prescription drugs in Canada would drop by $5 billion a year. So the plan here is that if you have government, and this is what Priscilla was saying earlier, as the national purchaser, that you ease up on what people have to pay for it. But again, the problem then is that government gets to decide what drugs you have access to. You know, there's some, I forget if it was a congressman or a senator, but someone in the US just the other day introduced a bill that I quite liked, which was to let anyone, if they are facing terminal illness, try any experimental treatment they'd like, even if that's unapproved, as long as they're consenting to it. And I like that a lot, because you should have a right to your own health care. And all of these my body, my choice people that you hear about in the abortion debate somehow don't seem to be as fervent in their advocacy of choice over where you get your health care from. And there's a big glaring hole in the liberals' argument on this, that you should have the choice, the freedom to do all this stuff, but when it comes to healthcare, you've got to go through the Politburo, you've got to go through the government. And that is fundamentally wrong and fundamentally inefficient and ineffective. And again, the answer to this question was already determined before the question was even asked. There's no doubt in my mind, despite the council's claim that it studied all of these systems, that it was going to this inevitably, that this was what they had already decided. It's like with electoral reform. Justin Trudeau had already decided he wanted ranked balloting before he even said, we're going to start this study, and then it ended up where that became just such a colossal backfire on him that he had to, excuse me, that he had to walk it back. But the timing of this, just to close off on this point, is relevant, because this process could have been done months ago, or it could have been done next year. It could have been done whenever. But Justin Trudeau knew that this report was coming. He knew what it was going to say. And more importantly, he knows that the election is in October and that the parliamentary session is basically done. So the only thing that politicians are doing between now and October is campaigning. Justin Trudeau knows all of this. So now what he has done by this report is he's allowed himself to be able to say during the election, we now have this study that says national pharmacare is what Canada needs. Doesn't matter if it's a liberal approved, liberal commission study. But so he can say, we're gonna implement this if we get elected. Which is why it's important that Canadians know the facts of these. Look, I'm a very firm believer, unfortunately, that a lot of people love the giveaways without necessarily knowing whether it makes sense and knowing whether it can even be paid for. I mean, we haven't even gotten to the part of this question yet where we have to figure out where that $15 billion a year is going to come from. But you look further to that point, and there's a sobering aspect of this in that government only ever spends. I mean, that's what government does. They spend money, they waste money. So it's very realistic that the cost of administering this scheme will outweigh any of those purported $5 billion a year in savings that we're supposed to be grateful for. But I may have told this story before. It's a very short one, don't worry. When I was campaigning a year ago, or I guess a year and a couple of weeks ago now in the provincial election, the NDP was planning to, if elected, put forward universal dental care, which is going to come next. It's going to get, once the pharmacare is in, dental care is next. But there was a woman that I talked to, upper middle class woman, nice house, nice neighborhood, seemed educated, said, well, I'm thinking of voting NDP. I really like that idea of universal dental care. And I said, look, I get that. I get that it's expensive, and I understand people wanting coverage, but the big question is who's going to pay for it? And she looked at me and said, oh, I never thought of that. Again, smart, educated woman, nice woman. I don't know if she voted for me or not, but we had a great conversation. But she heard this giveaway and never even crossed her mind that you have to find a way to pay for it. And I fear that that's going to dictate a lot of the reaction to this national pharmacare pitch as well. People that say, yeah, I love the idea of it. If you got to get a prescription filled, not having to pay more than $2 or $4 or $6, but people saying that, yes, it's a great idea, without thinking of what needs to be the most fundamental question, can we even afford this? And Trudeau already has had to keep bumping back this idea of an elusive balanced budget to throw a $15 billion a year expenditure in there and think the math is going to add up. I highly doubt it. I highly doubt it. Got to wrap things up. Big thanks to all of you who for tuning in. If you are able to give us a hand in covering the stories the mainstream media is not, head on over to tnc.news. You can join the Andrew Lawton Heritage Club. If you have any questions, shoot me an email, andrew@andrewlawton.ca. We'll talk to you next week. Thank you. God bless, and good day, Canada.